The state designated entity in New Mexico is the New Mexico Health Information Collaborative, and is running both the Health Information Exchange and the Regional Extension Program for the state. It's a collaborative effort made up of about 40 stakeholders. We decided we couldn't build the state infrastructure from the ground up, so we're contracting with an entity outside the state, a nonprofit called Loveless Clinic Research. Well, we work very closely because they're both managed from the same organization, so that's a nice tight linkage there. We would like to see them, the Regional Extension Center, continue to have a role in helping doctors achieve meaningful use. I don't know quite what that's going to look like until we see the further regulations, but we think that if there's an ongoing push for quality measures and things like that, that the Regional Extension Centers are going to provide a valuable service into the future in assisting doctors with it. One of the things that I think you have to think about is that there are HIT coordinators in every state, and we really need to come together, I think, as a group and have a little more intercommunication and a standard game plan going forward, because at least in my conversations with them, some of us are sort of dealing with exactly the same problems, and then there are others of us who have solved those particular problems but are looking at different problems. And I don't feel like we have quite the cohesion that you have, like, for example, among the state public health directors or the state chief information officers. We don't plan to require certification at this point. We do require the providers to enroll in the Health Information Exchange so that we can do authentication for them. We have a list of about 30 network services that we proposed to our stakeholder group. What we want to do with them is take them through a process of defining which services are most valuable and which services we can deliver most quickly, and then stage the rollout of the other services as we go along. But it will depend a lot on what they think is valuable, not what we think is valuable. Well, the biggest challenge is, of course, trying to achieve meaningful use for the physicians we've already contracted to bring up. And we're managing that with more sort of traditional organizational and project management techniques. The other big challenge, of course, is sustainability. And one of the things that we've been successful doing is right out of the gate, the state's contracted with the Health Information Exchange to provide electronic reporting of surveillable conditions and outbreaks of infectious disease and things like that. That's an ongoing contract that'll provide some revenue support for them into the future. We're also looking at the possibility that the state will be able to leverage the information exchange to provide immunization data. We just got a CDC grant to do that. So we see the state as a major client. We're also, the state Medicaid agency is looking to the Regional Extension Center to help bring Medicaid paid physicians up to meaningful use. I think the real challenge for this election cycle is governors who may change the state's direction and may decide that healthcare reform or state HIT coordinators are really not that important anymore. And that's a huge, I mean, I think ONC and the feds have to get in front of that, and NGA for that matter. We found that getting the word out to consumers was one of the more difficult things. We have 2 consumers on our board, so that helps, but they tend to be people who have self-selected themselves, are already interested in it. We've done some educational outreach sessions. We're working through the community college system to do some more of those, but I think getting people's attention on this is really challenging right now.